Hey, Central New York. Hopefully you guys are having a great day. Happy, healthy Monday morning to all you guys. I'm excited to be here today. Got here early, got all my stuff done. Wanted to put together some videos. And one of the videos I wanted to share, and it's on my list that I wanted to talk to you guys about, is insurance and health insurance and whether or not they cover chiropractic care. I will tell you, to this day, 30 years after I opened my practice, it's probably still one of the more prominent questions I get and I look at as an obstacle for some people. And unfortunately, it's an obstacle many people place upon themselves. And I can appreciate that, certainly, but I think it's something that we need to talk about and not tiptoe around that conversation. So before I do, I wanted to ask you guys, if you like our videos and you find them valuable, make sure you like the video and make sure you share them to some friends, to some family members, whether they're local or not, so that they too can learn some different ways to take better care of their body, themselves, realize that there's some hope out there for them if they're suffering from some things, but also maybe to get them in a little bit better mood. Good way to start the day, hopefully, with the information I give you, find it valuable. So let's talk about that. So insurance. So I remember early on in practice, I had a woman, and she said, she wasn't in the office. I was at my dad's restaurant, Borio's restaurant, which my dad runs, and I was sitting there, and she said, boy, I'd love to come see you, but you're not covered by my insurance. And I remember sitting there going, like, I didn't understand that. Like, I would love to see you, but you're not covered by my insurance. So my first thought would be, wow, so somebody would rather, if you will, suffer, or somebody would rather do things that are less valuable, less impactful, things that are less likely to, hey Jerry, things that are less likely to give them a benefit in their health because it's covered rather than not. A couple of years into practice, I heard a few people say to me, hey, you know what, I'd love to get your care, but it's not covered by insurance, but my spinal surgery is. Or, I'm getting some nerve blocks and they don't help me as much as it's getting adjusted by you, but they're covered by my insurance. Irrespective, they cost thousands of dollars, to have those things done, right? So again, you start thinking about that as the doctor on this side of it, and I'm like, wow, that doesn't even make any sense to me. And then you realize later on that, and again, I say this out of love, I think often I care more about somebody's health or the ability for them to thrive than they do. Right? So you start looking at that. So I know money can always be an issue for people. I don't question that. I mean, there are some people that, barely have enough money to pay their gas or pay their apartment or whatever. So I get that without dismissing it. But what I do want to share with you is I ask you to do this. If you're somebody out there who said, I'm not going to get care because finances are a problem, or I'm not going to get care because it's not covered by my insurance. Your insurance doesn't cover your car if it breaks down. Right? I mean, if your transmission went, if you need a brake job, if you blew a tire, whatever, I mean, you wouldn't hand them your Blue Cross or Blue Shield card, but you would still, and many times those repairs can be expensive, but, you would find a way to pay it. And I think we forget that the vehicle of life, our body, is so critical in equating the quality of our life, the joy of our life, hell, the financial benefits in our life, right? I mean, people that are healthy make more money. I mean, it's not me saying that, right? If you're healthy and you wake up every day and you feel pretty good, I mean, chances are you're going to get after it that day, right? And it's going to create greater financial success, whether you wait tables, whether you're a hostess, whether you're a plumber, whether you're an accountant. I mean, tough to do books if you got chronic headaches and neck pain and digestive problems and asthma, right? If you're a teacher, difficult to do that if you feel lousy, right? So that's where my head goes. So one, your health equates to the amount of money you're going to make. Healthy you are, you make more money. And then if I look at it, the quality of our life, in other words, the joy that life brings, going to a basketball game, going to a football game, playing a game of golf, hell, going out fishing, taking a walk with your dog. I try to take my dog for a walk every day, right? Just going out and taking a walk and feeling good enough to do that and having the energy to do that. Like, think about how beautiful that is. Like, what's that worth? Sometimes we don't know until we can't do it, right? But something to think about. So if we know the joy of our life is better if we're healthier, and if we know that we make more money if we're healthier, then why would I let an institution like an insurance carrier, if you will, dictate what my quality of life is? So sometimes it comes down to this. People spend a lot on their health insurance, more now than ever. So in the last really 15, 20 years, the cost of personal health insurance has gone up 30, 40, 50, 60%. Not only that, they cover less. So copays and deductibles now have gotten a lot higher. So a lot of times we're paying more out of pocket than we ever did. And I appreciate that. I really do. But I remember when I was a kid and my parents brought me to a chiropractor, and they brought my brother Tony and my sisters Peggy and Nancy and my mom and dad. Like, insurance didn't even exist for chiropractic care at that point. So I remember my dad and mom, every month when we went and got our health adjustment, we didn't go in because we had health problems. We went in at that time because it was good for us to get adjusted, So there was never insurance. I don't even know if the chiropractor at the time even took insurance, if there was even coverage at that point. I guess, I don't know, it's something I never even asked my parents. But I did realize that there was an enormous value that my parents saw for it, so they made sure that we all got adjusted. They had made sure that, wow, our kids are healthier if their spine and nervous system's healthier, so irrespective of cost, we're going to make sure that we get the kids in, right? Irrespective of the cost, we're going to make sure my kids have good, healthy teeth, we're going to make sure they got glasses, and we're going to make sure that their spine and nervous system is really healthy, right? And that's the way the mindset was. So I have so many people that, over the years we talk, and insurance becomes such an issue because we spend so much money for it. But I would ask you, if you think that way, and I appreciate it because I spend a lot for my health insurance too, I would ask you this. If you look around your life and you realize, do I have other things in my life that I spend a lot of money on that bring me joy? Maybe it's your car, maybe it's a boat, a snowmobile, maybe it's a motorcycle, maybe it's some of your clothes, right? Maybe it's some things in your house. Maybe it's a television set, maybe it's some furniture that you have. Whatever that is, when you look around your life, when you look around your world and you realize, wow, look how much money I spend on things that bring joy to my life. This has got to be one of those things. When it comes to taking care of yourself, it has to be one of those things. You have to view it as one of those things. It's going to be something that, hey, you're going to pay money out of pocket. Maybe you think it's a lot. Maybe you don't. I don't know. One of the questions I always ask people is, how sick and diseased do you have to be before you think it's affordable? Right? I mean, if it doesn't hurt really bad or you don't feel really sick, well, maybe in your mindset you might be thinking, well, it doesn't, I could deal with it, right? I could deal with it, but then how sick and diseased does it have to be before you go, wow, that's not a bad deal at all, right? I mean, I don't know. That's a decision you make. But I will tell you this, that your body is going to get sick and diseased and break down unless you take care of it. And even if you take care of it, it's still going to go that way as we age, but it's going to do it a lot better. So if you think of a car, you could take really good care of a car and you can get 100 years out of a car and it'll look beautiful. And then we hear people, they're in their 20s and they drop dead because they didn't take care of themselves, right? And a car will do the same. Hell, a car will die in 10 years if you don't take care of it. So the question is, what type of love, what type of attention, what type of effort are you putting in your body? And finding it valuable for you to do that, and finding that and realizing that, hey, some of that or a lot of it or all of it is something that I got to pay out of pocket. But what's the return? Healthier body, you're going to have more joy. You're going to have more love. You're going to make more money. You're going to have more freedom to do what you want, more independence to do what you want. And it is pretty profound. I'll share one last story with you. There was a story done by Blue Cross and Blue Shield, and it was done in the state of Illinois. And they were trying to evaluate different ways to save money. And one of the ways they thought they would save money is utilizing chiropractors as primary access points for all other medical care. And why they did that is they thought, hey, listen, much of our expenses are medical in the use of prescription drugs and hospitalizations. So let's bring in some docs that are very knowledgeable about keeping people healthy so that they would use less drugs and less surgery. So they did this in the 90s, late 90s, and the results were profound. When I say profound, I mean the utilization of prescription drugs was down by 90%. That doesn't mean never take a prescription drug, and this isn't an anti-drug. It just meant that if I was healthier, I was less likely to use prescription drugs, right? The utilization of over-the-counter drugs went down 75%. Hospitalizations went down over 50%, along with some other phenomenal benefits that they had. And this study carried on for 4 years. Amazing, right? And guess what they did? They panicked. They knew that it was going to help, but they didn't realize it was going to make that big of a profound impact. And you got to remember that the medical companies run the insurance companies because it's a way for them to all make money. So they basically stopped the program because it had too much of a positive effect. It was cutting down too much of the income or the revenue stream, if you will, that the medical community, or not the MD up the street, if you will, but those that were running the business part of it really got nervous and said, hey, this is off. They wouldn't release the results of the study. It actually took an act of Freedom of Information Act in order to get it out several years later because they're federally funded. And when the results came out, again, everyone was really taken back by how profound it was. Why is that? It's not that chiropractic's superior than anything. It just means that if we take better care of ourselves and we surround ourselves with doctors that are focused on taking better care of you, I mean, I don't think it's too big of a leap to realize I'm less likely to get sick and I'm less likely to get diseased, right? I mean, if I have no dentists in village after village after village, chances are people are going to have sicker teeth, right? But if I have a bunch of dentists, right, guess what? People are going to take better care of their teeth. So same thing with chiropractors. If there's a lot of chiropractors and you're under care and it's being provided for and help being paid for, guess what? More people were willing to use it, and as a result, guess what? People had great results. And that's really what my practice is all about. I realize if I treat people, I'm never really going to make a profound impact in their life. But if I take care of you, if you're somebody that comes in, I say, listen, I'm going to take care of you. I'm going to establish a relationship with you so that I could be part of your health care. Again, it doesn't mean you're never going to get sick, just like brushing teeth doesn't mean you're never going to get a cavity. But it does mean the likelihood of you living a better, stronger quality life is significant. It really is significant. And I'd love to be that doctor. Hi, Judy. I'd love to be that doctor if you're local and I resonate with you. Boy, I'd love to be that doctor to take care of you. So do me a couple of favors, guys. Make sure you like our videos. Make sure you share them. Post them to some groups. Maybe share them with people privately on your phone or whatever. If you see some other people that would really benefit and resonate from being in our office. Certainly you can share our information if you know that somebody needs to be under care. I would love to see them. If you're listening to this video and you're not a patient of mine and you're not being taken care of our office, hit the link above, hit the link below. Go to our website. You can print out all your paperwork. You could set up a new patient appointment right from the website. We only do a $37 checkup for you to come in and get evaluated and get that includes your x-ray and everything. And I did that a number of years ago because I don't want money to be the obstacle for you not to come in. You know what I mean? I don't want you to be, well, geez, my insurance doesn't cover it, like we were talking about today, that I'm not coming in. No, come on in. Let's look inside you. You know, you want to check your cholesterol levels, right? You want to check your bone density, right? In this case, we're going to check the health of your spine and nervous system to make sure that your body is functioning, and where it's not functioning well, let's at least take care of that. And then I can nudge you on a few other parts of your health so that you can live a better, longer, better quality life, there's no doubt. Have more joy, have more love, have more freedom, have more independence. That's what seeing us and being under care will do for you. So, hey, love and appreciate you guys. I'll quit rambling. Love and appreciate you guys. Live a wonderful day today. Really enjoy it. Do something special for somebody else. Remember to do your journaling, right? Write down three things you're grateful for, 3 things you're looking forward to, and 3 things that you are fantastic at. Get some good self-talk. And God bless. Virtual hug. Have a great day. I can't wait to see you in my office.